Let's talk about COVID-19.
What is a coronavirus? Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause illness in animals and humans. In humans, coronaviruses can cause respiratory infections ranging from the common cold to more severe diseases. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012, and SARS-CoV-2, the name of the virus that causes COVID-19 that was first reported in December 2019. So, where did this new virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels, and SARS-CoV from civet cats. The animal reservoir of the new coronavirus is not known yet. How does the disease spread? The disease can spread from person to person through droplets, when an infected person releases those droplets through coughing, talking, or sneezing, for example, when close to another person. It can also spread when infected droplets land on objects, and when another person touches them and then touches their eyes, nose, or mouth. What are the symptoms? The incubation period, which is the time taken from exposure to the virus and development of symptoms, is on average 5 to 6 days, but can range from 1 to 14 days. There can be a range of symptoms, from very mild to severe. Some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reported loss of their sense of taste or smell, and some may develop a skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. About 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems, such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, generally known as PCR. This test identifies the virus based on its genetic fingerprint. There's also a blood test that can check for antibodies against the virus, which may show that someone was infected in the past. How is it treated? The treatment for COVID-19 is mainly supportive care. Medicines against the virus are currently under investigation. How do we prevent transmission of the virus? There are a number of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing with a flexed elbow or tissue, and throwing the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub, maintaining at least 1 meter distance from people, and the appropriate use of masks and personal protective equipment, especially in health settings. It's important to stay home if you're feeling unwell and to call a hotline or your medical professional. But if you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider.
At BART,
We are providing personal protective equipment such as face masks. We wear a face cover to protect each other.
Face covering. Cloth face coverings are not respirators or disposable face masks and do not protect the worker wearing them from exposures. Cloth face coverings are only intended to help contain the wearer's respiratory droplets from being spread. Used in this way, CDC has recommended cloth face coverings to slow the spread of the virus that causes COVID-19. Wearing them may help people who unknowingly have the virus from spreading it to others. What is an N95K N95 respirator? An N95K N95 FFR is a type of respirator which removes particles from the air that are breathed through it. These respirators filter out at least 95% of very small particles. N95K and 95FFRS are capable of filtering out all types of particles, including bacteria and viruses. The following are steps to put on and remove a respirator. Seal check. Positive pressure check. This test is performed by closing off the exhalation valve or cupping the mask with your hand. Breathe air into the mask. The face fit is satisfactory if some pressure can be built up inside the mask without any air leaking out between the mask and the face of the wearer. Negative pressure check. This test is performed by cupping the mask with the palm of your hand. Inhale gently so that a vacuum occurs within the face piece. Check for evidence of inward leakage. Is a good seal important for N95K and 95? Without an adequate seal, air and small particles leak around the edges of the respirator and into the wearer's breathing zone. Can I have facial hair? It cannot interfere with the seal. Do's: wash your hands before touching the mask. Inspect the mask for tears or holes. Find the top side where the metal piece or still edge is. Ensure the colored side faces outwards. Place the metal piece or still edge over your nose. Cover your mouth, nose, and chin. Adjust the mask to your face without leaving gaps on the sides. Avoid touching the mask. Remove the mask from behind the ears or keep the mask away from you and surfaces. Discard the mask immediately after use. Wash your hands after discarding. Don't leave your nose exposed. Don't leave your chin uncovered. Don't allow gaps on the sides of your mask. Don't cover only part of your nose. Don't lower your mask to rest around your neck. What kind of respirator does BART provide for voluntary use? N95K and 95. How can I obtain an N95K and 95 mask? All respirators are available to all employees upon request by submitting a request to your supervisor or special liaison at no cost. What do I need to know about respirators for voluntary use? BART provides respirators for your voluntary use, and you need to take certain precautions to be sure that the respirator itself does not present a hazard. You should do the following. 1. Read and heed all instructions provided by the manufacturer on use, maintenance, cleaning and care, and warnings regarding the respirator's limitations. 2. Choose respirators certified for use to protect against the contaminant of concern. NIOSH, the National Institute for Occupational Safety and Health of the U.S. Department of Health and Human Services, certifies respirators. A label or statement of certification should appear on the respirator or respirator packaging. It will tell you what the respirator is designed for and how much it will protect you. 3. Do not wear your respirator into atmospheres containing contaminants for which your respirator is not designated to protect against. For example, a respirator designed to filter dust particles will not protect you against gases, vapors or very small solid particles of fumes or smoke. 4. Keep track of your respirator so that you do not mistakenly use someone else's respirator.
We offer training. We disinfect. We install hand sanitizer. We promote social distancing.
What if I am sick? Stay home. Do not enter any BART facility if you have the following symptoms: cough, fever, chills, muscle pain, shortness of breath, sore throat, new loss of taste of smell. Conduct self-screening at home by using CDC guidelines. Seek medical attention if you have trouble breathing, persistent pressure in the chest, new confusion, inability to wake or stay away, bluish lips or face. Tips: avoid touching your eyes, nose, and mouth. What you need to know about hand washing. Why should you use soap and water to wash your hands? Germs can get onto your hands and items you touch throughout the day. When your hands may be dirty, it's best to wash with soap and water to remove whatever germs and chemicals may be on them. How long do I need to scrub when washing my hands? Scrubbing your hands for at least 20 seconds is the most effective. Do I have to clean under my fingernails? Yes, germs like to hide under fingernails. Make sure to clean there, too. What if I don't have soap or water to wash my hands? If soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Alcohol-based hand sanitizers can quickly kill most types of germs on the hand, but may not kill certain bacteria and the viruses that cause diarrhea. You should wash your hands before eating or after using the restroom. Protect yourself and others by washing your hands with soap and water.
Benefits. For all COVID-19 related benefits to which employees may be entitled under applicable federal, state, or local laws, please contact Human Resources at 510.464.6219 or HRCOVIDBART. For up-to-date information, please visit BART's COVID-19 website at the link below.